but are peptides legal for sports? Like, let's say I'm a young athlete that's watching right now. Can I use peptides to maybe enhance my performance?
It's such a gray area. So
it is, right?
So look, a lot of people are doing it. Just about everybody's doing it, right? Technically, it's a performance enhancer.
Gotcha.
So technically, no.
Yeah.
A lot of it can't be, some of it can be tested for, some of it can't be tested for very well. It's definitely a gray area. It definitely enhances you.
Yeah.
So that's kind of what a performance enhancer is, which they don't like, right?
Yeah.
So it definitely will enhance you, but it's very, very gray because it's not as black and white with testing. Like if somebody has crazy testosterone or HGH levels, well, you know. If they just have less inflammation in their body, how are you going to know, right?
True.
So, but some peptides you will be able to know.
Right.
So it just depends. Like the human growth hormone stimulating ones, you'll be able to know. So
let's talk about the famous ones then. You know, the ones that people do come up to you in person, like I've seen it happen, right? The GLP-1 or like the Reta, right?
Retatrutide.
So, Retatrutide, there it is right there. Okay, so this seems to be the one that even me, I'm hearing more and more about. Let's go into Retatrutide, right?
How many times, just the other day,
it's crazy.
Somebody walked up, everybody walks up and talks about, that's the newest, it's literally the hottest one on the planet right now.
Yeah.
I mean, it's literally the hottest one.
Yeah.
It's the 3.0 of the GLP-1s, right? You initially had semaglutide, that hits one receptor that can, cause the appetite to be suppressed. So you lose some weight, right? You can lose a lot of weight.
Yeah.
Then there's the second one that came out was trizepatide, hits two receptors. Okay. Kind of the new improved one, if you will.
Yeah.
Less side effects. Semaglutide had a lot of side effects. Trizepatide had a lot less. The problem with both of them, they'll both help somebody who needs it to lose weight, but they don't know the difference between muscle and fat, right? So you start seeing, everybody's heard of Ozempic face, right? Because you're losing fat in your face, but your muscles are getting droopy because they're getting weaker too. You're losing everything. You don't just lose, it doesn't distinguish between one of the two.
Yeah.
So what was really interesting with Retatrutide, that's the 3.0, right? That came out. It hits three receptors, the glucagon, right? So essentially what it does, it reduces inflammation in your body significantly. I mean, people are dropping weight really fast. The initial pounds are going to be water weight, but it makes you feel better because if you have inflammation causes all disease and pain, right?
Yeah.
If you have knee pain, you have inflammation. Whether you can see it or not, if it hurts, there's inflammation in there, okay? So it kills the inflammation, drains it out of your body, causes your metabolism to be really kick-started, go way quicker. So it actually makes your metabolism work better. And then it does suppress appetite. But what's interesting, it doesn't repress appetite as much as the other two, right? Yeah. But in all the studies of clinical phase 3, that they have a significant amount more weight loss. So you're able to preserve muscle with Retatrutide, okay? Because you're eating, you still have an appetite. You just don't eat as much.
Right.
Okay. It's hitting another receptor that comes at it from a different angle. And you essentially can, honestly, it's like the miracle peptide at this point, because they've already linked it to, people with fatty liver, cirrhosis. They're having unbelievable results with that. Collagen production increases, blood flow increases.
Yep.
So it's not like one of those things where it's a trade-off.
Yeah.
Hey, I'm gonna get skinny, but I'm gonna hurt some things, right? It's actually fixing a lot of things other than just weight loss, and the side effects are significantly less. I almost see nobody with side effects.
Bring me to the basis of it though. Are we talking it eats fat with these receptors and what it's telling you, or is it one of those things that it's killing your appetite, or is
both?
It's both.
Both,
so it's
triple agonists. Yeah.
You're not really eating, and then paired with the peptide itself is targeting fat.
Exactly.
Okay.
Exactly. But
that's huge.
But the thing is that's big, that's important, is that you are still eating. You're just not eating as much, right?
Gotcha.
Like semaglutide, we would have patients, they come in and man, they don't eat all day. They say, I have to fight to get one meal down. Like I'm losing weight, so this is great.
Damn.
But then that's your Ozempic face, right? Because you're So then, but this, you're hungry. So, say you have breakfast. So you wake up in the morning, you eat, you're hungry when you wake up. Yeah. But you're not going to eat what you normally eat, right? You're not going to have this big plate of food. You're going to eat a lot less. Then 4 hours later, you're hungry again.
Yeah.
Like you're hungry. It's not like that's dampened, but you're just not eating as much. And then the food noise, what they call it, so, is gone. Like you don't have, if you like to eat chocolate chip cookies, right? Like you don't have those desires to get those things. So you just pick the healthier options.
That's
right?
nice. Yeah. Okay. I like that.
If it doesn't matter to you if it's a cookie or a salad, like I might as well get the salad because what does it matter? Because you don't really care.
True.
It gets that desire. It helps with addictive personalities as well. I mean, they're linking it to a lot of amazing things. Yeah.
So the research is still coming out. Like they're finding other stuff that it's doing for people as well.
Man, it's all been positive too, man. It's just about everything. It's been unbelievable. Yeah.
Let's talk about another one that's really been hitting hard. Glow.
Glow.
Okay, Glow. And this is the one that I think this is initially when we first talked about peptides. You were like, Chris, Glow is kind of crazy, bro. So
Glow is good. I'm not as hot on it anymore.
Yeah.
That because look, things change. You had to evolve with the times, right?
Yeah.
When new research comes out, you go with it. So Glow is a stack. Glow is a stack of peptides. It's very, very popular. It's BPC 157, TB 500, and then GHKCU, which is copper peptide, right?
Yeah.
So all those are all amazing, right? The problem is when you put them in together in a blend, then the copper actually destabilizes the rest of them.
Yeah.
So they work, but they don't work nearly as well. So the best way to do it is you have the BPC 157 and the TB 500 in their own vial because those are stable together. They can stay together. Mm-hmm. And then you have the copper peptide on its own, and then when you inject them separately, right? Yeah. When you put them together, they just don't work as well. So it's still really hot. Everybody's doing it. I get patients off of it all the time though, because look, if there's something better, we're going to do the better one because it's the same components, same peptides, but we want to deliver it the best way. It's going to work the best for the patient, right? Yes. So, and then that's a big one, and then of course another stack, just those two without the copper. Mm-hmm. One BPC 157, TB 500. They called it the Wolverine stack. Have you heard that?
I like that though. The Wolverine stack. Clarify the Wolverine stack. Like if I wanted to be the Wolverine stack, what is that?
All right, man. You get a cut right now on you.
Yeah.
If you're Wolverine, right?
Yeah.
Get a cut, just heals instantly.
Heals up. Yeah.
That's why I got the name.
Wow.
Because it's tissue repair like crazy.
Oh, okay.
So it helps with tissue repair. That's what we commonly do for people with joint pain.
Yeah.
Helps with anti-aging as well. But that's a big joint pain one because Wolverine says it.
Let me clarify to my audience as well, because sometimes when I talk to Lawrence, these numbers they get confusing and they're fast, and you're good at hey 1155 167 you read them all. I've decided this week, but a lot of my guests they have a lot of information, very smart people, and I'm putting together a Substack that we're gonna break down these different things that you're offering, whether it be like a stack, a Wolverine stack. Like people want to know, hey, what specifically is this, rather than trying to stop my video, go through the numbers, So I will be putting it out for y'all. So just so if you don't get the numbers, like sometimes I mess up on it, so I'll have it out there. So
yeah, we'll break it down. What kind of person for this? What type of person for that?
Yes, yeah, because there are a lot of them. Is there another one that you really are like, hey? So we got the Wolverine, we've got obviously the Hollywood. Because now the names themselves are pretty interesting. What's the other one that I'm missing?
Well, and I'll tell you more about the Hollywood too.
Yeah.
I didn't really go into all the different ones with the Hollywood. So it's like BPC 157, TB 500. That's a staple in a lot of them, right? Because it's really good. It's good for tissue. It's good as you age. Copper peptide, of course. Mm-hmm. A growth hormone stimulating one like tesamorelin, which is great for like somebody with visceral fat.
Yes.
Or they do CJC 1295 with ipamorelin. And then there's a big one, MOTS-C.
MOTS-C?
MOTS-C, yeah.
Tell me more about that.
Man, that's an energy one.
Okay, cool.
It works really well. Basically what it does, it supercharges your ATP. What is your ATP? Your ATP is what supplies the energy to the mitochondria, which, remember like in high school biology, right? Powerhouse of the cell, right? Mitochondria. So that makes everything going. So it's like, like me, myself, and like I get a lot of people. It's a lot of people's favorite actually.
Yeah.
Because your energy just goes through the roof. It's a natural. It's not like a jittery, like you had coffee or something like that.
Yes.
It's just a natural. You wake up, you're ready to go.